I will present the research about the cephalometric characteristics of post-orthodontic female patient with attractive and unattractive frontal post smile. No agreement has been reached regarding the morphological characteristics needed to achieve an attractive smile after orthodontic treatment. The purpose of the present study was to compare skeletal, dental, and soft tissue morphologies by lateral cephalometric analysis between post-orthodontic patients with attractive and unattractive frontal post smile from the Japanese population. A total of 100 female patients had undergone orthodontic treatment, including culture of second molars, and were aged younger than 30 years old at the completion of active treatment in Nippon Dental University Hospital were selected. Patients with cleft lip or cleft palate who had undergone orthodontic surgery were excluded. To evaluate select images, 10 male and 10 female students enrolled at Nippon Dental University who had not yet completed the course in smile aesthetics in orthodontics were selected as evaluators. The 20 patients with the most attractive smile were defined as the attractive group, and the 20 patients with the least attractive smile were defined as the unattractive group with appropriate image quality according to the consensus agreement of two orthodontists. 20 individuals were selected as the control group with normal occlusion and no obvious asymmetry. Cephalograms were taken in the intercuspal position with relaxed lip and facial muscles. Figure 1, cephalometric analysis skeletal. CHP indicates constructed horizontal plane. Figure 2, cephalometric analysis dental. Figure 3, cephalometric analysis soft tissue. All reference points for each patient were individually translated as sella as the origin and rotated on the sella nation line at 7 degrees above the constructed horizontal plane. Medians of the XY coordinates for all reference points were calculated for each group and superimposed. Results: skeletal anterior-posterior measurements showed no significant differences between the groups. In skeletal vertical measurements, the unattractive group showed significantly larger ascent to mandibular plane, palatal plane to mandibular plane, anterior facial height, lower facial height, and lower facial height, anterior facial height when compared with the attractive group. For dental anterior posterior measurements, no significant difference between groups were found. In vertical dental measurements, the unattractive group showed significantly larger occlusal plane to ascend, palatal plane to occlusal plane, and maxillary central incisor to a palatal plane than the attractive group. In the anterior-posterior soft tissue measurements, no significant differences was seen between patient groups. In soft tissue and dental vertical measurements, lower face, upper lip length, and upper lip superior to palatal plane were larger in the unattractive group than in attractive group. Using median values of the XY coordinates of reference point for cephalometric measurements, morphological characteristics were graphically compared between patient groups using superimposed images as shown. Discussions: significant hyperdivergent tendencies were observed in the unattractive group but not in the attractive group, not in United States and Turkey. Such inconsistencies may be attributable to the ethnic or cultural differences. Hyperdivergent tendencies are often observed after conventional orthodontic treatment in patients after adolescence, and prevention with appropriate treatment option is therefore necessary. In addition, To create an attractive smile, surgical orthodontic treatment, including maxillary impaction osteotomy, could be recommended as a possible treatment alternative for specific cases with a severe hyperdivergent skeletal pattern. Therefore, to create an appropriate smile arc as part of an attractive frontal smile, it is considered important to identify excessively inclined occlusal plane during treatment planning and avoid tooth movement that does not produce the desired aesthetic result. Conclusions. Cephalometric analysis revealed that an attractive frontal post-smile in post-orthodontic Japanese females are characterized by a hyperdivergent skeletal pattern with extruded maxillary incisors and steep occlusal plane, accompanied by a long upper lip when compared with patients achieving attractive post-frontal smile. Next, I present research about the layperson's preference of the transverse occlusal plane in asymmetric facial model. The purpose of this article is to determine if the nose and chin deviation affect the layperson's perception of transverse occlusal plane. Frontal portrait, including face, hair, and neck taken of young female patients, were used as a starting. This picture was edited and morphed, creating a symmetrical facial model SFM using Adobe Photoshop CS3 Extended. A symmetrical facial model AFM was created. The dorsum, tip of nose, and chin were digitally shifted 3 mm to the left. Figure A is AFM and B is SFM. Both the SFM and AFM displayed a dental midline that was perpendicular to the interpapillary line and horizontally coincident with the philtrum. The next step was to create 6 different versions of the AFM face, which had a different degree of transverse cant of the occlusal plane. In each version of the AFM, the transverse cant of the occlusal plane was modified, obtaining the angle between OP and interpapillary line of +2 degrees as in shown figure 2A, -2 as shown in figure 2B, +3 degrees as shown in figure 3A, -3 degrees as shown in figure 3B, +4 degrees as seen in figure 4A, and -4 degrees as shown in figure B. A visual Likert scale was used and delivered via web survey software. A cohort of 150 laypersons was selected from a pool of patients. During the first step, the participants only had to observe the images. On the second time, the images were displayed in a different random order, and the participants were instructed to evaluate each facial expression according to their personal attractiveness criteria on a Likert rating scale from 1 to 4. 1 is being less attractive, and 4 is more attractive. The descriptive analysis for all pictures is presented in Table 1. It shows that the mean rating between control feature SFM and the AFM are very similar. The bar chart shown in Figure 5 indicates OC +3 degree, OC -3 degree, OC +4 degree, OC -4 degree are statistically equivalent between them. Additionally, those data points are different statistically from AFM, SFM, OC +2 degree, and OC -2 degree. Also, AFM and SFM are statistically equivalent, and these have shown a statistically significant difference from OC +2 and OC -2 degree. The subject rated less attractive on occlusal plane cant of 2 degree or greater compared with the control picture SFM. This supports the assumption that the inclination of the occlusal plane has a significant effect on the perception of facial attractiveness. For all pictures, the mean values were similar to the ones where the occlusal plane was canted to left side or the right side. This indicates that the direction of the occlusal plane cant is not relevant in faces with asymmetric noses and chins because the direction of the asymmetry did not influence the ratings. No statistically significant differences between the rating values of the SFM and the AFM were found, which suggests that the asymmetries introduced in the nose and chin were not perceptible for most of the subjects. Increasing the occlusal plane cant angulation consistently decreases the attractiveness of a smile. In a face with a symmetric nose and chin, the direction of the occlusal cant is not a relevant factor to consider. The occlusal plane should be as parallel as possible with the interpupillar line or the horizontal plane of reference. If an occlusal cant is present, it is more favorable to have an occlusal cant of less than 2 degrees of angulation, regardless of the direction of the nose and chin deviations. Last, I will present the research about the facial flow concept on organic orofacial analysis that the vertical component. The purpose of this study was to generate new concepts and guidelines for comprehensive and organic facial analysis so that clinicians may depend less on artistic skill. A 44-year-old woman presented. Impression and photographic and video documentation were then obtained for orofacial analysis and treatment planning purposes. The most important references line in the frontal plane were the interpupillar line and the hypothetical FM. These two lines define a T, which functions as the foundation of the facial architecture. In the author's opinion, the facial T does not need to be perpendicular to the face to make for an attractive and harmonious appearance. The author finds the idea of defining a specific horizontal line and perpendicular line as the midline for developing a beautiful smile both unnecessary and unrealistic. Facial lines and anatomic components do not all need to be strictly parallel to look aesthetically pleasing, but only to create overall visual comfort. When a person smiles, a line can be drawn connecting the glabella, nose bridge, philtrum, and chin. The author referred to this line as the facial flow line FFL and consider it the foundation of the entire facial architecture. The author believed that all facial structures have a position relative to this line, which is responsible for a sense of harmony and balance. FFA usually points to the patient's left or right side. The side of the face where FFL points have been named by the author the green side and the opposite side the red side. In the case study shown in this article, the face flowed to the patient's right side, meaning the right side of the face was the green side. Clinically, this means if a small midline shift or inclination forced into the green side, it will be less perceptible and create less visual tension because it will blend with the other facial structure, organization, and parallel relationship. In this patient, the first diagnostic marking blended in completely with the facial architecture, and the smile design was kept with the DM slightly inclined toward the green side and replicated with the trial restoration. The teeth were minimally prepared and ceramic prostheses were bonded. When the DM can't point to the opposite direction of the FFL, it falls into the right side and can create some visual tension and discomfort. In addition to the angulation of the DM, the tip of angulation of the central incisors and the right lateral incisor also point to the right side, creating considerable visual tension. This patient, from the FF point of view, was a good candidate for orthodontic treatment to correct the DM angulation and the angulation of the lateral incisor, avoiding the direction of the right side. Sometimes the nose and chin can go in opposite direction, describing a curved banana-shaped FFL. The position of the FFL between the leaf frame will allow clinician to determine which is the green side and which is the red side. Discussion. The concept presented is based on human perception and helps us understand the arrangement of facial structures so that clinicians can better decide whether the final smile design will blend with the facial features or incorporate other specialties which can change the facial frame to improve the final outcome. Thank you for your listening.